Good afternoon. Dr. Peter England's my name. I'm an obstetrician in the inner Melbourne area. Today I wanted to talk for a few minutes about the idea of trimesters. So what is a trimester in pregnancy? Quite simply, pregnancy can be divided into 3 time periods. Those time periods are roughly 3 months each, making up 9 months. The first trimester, therefore, we will say is around 0 to 13 weeks. The second trimester we could call 14 to 27 weeks. And the third trimester we could call 28 to 40 weeks. These divisions are quite arbitrary, but you will hear of those terms and read about those terms quite often. Note that I actually have the 14 weeks long second trimester because pregnancy is in fact 9 months and 1 week, 40 weeks, just slightly longer than 9 months. Dating of pregnancy can be a little bit confusing in that way because, as many patients correctly point out to me, it's actually only 38 weeks from the time of fertilisation or conception of the pregnancy. However, for hundreds of years historically, pregnancy is conventionally dated from the beginning of the last menstrual period, which usually is around 2 weeks prior to ovulation. Hence, pregnancy being approximately 40 weeks long on average. So in the first trimester, the sorts of things that happen are the discovery of pregnancy itself, usually around 4 to 5 weeks after the last period, and the development of a lot of pregnancy symptoms, which we've talked about previously. Such things as nausea, tiredness, breast tenderness, bloating of the tummy, change in bowel habit, noticing a need to empty the bladder more often and being thirsty are just a few of the typical normal symptoms that a woman will encounter during early pregnancy. Generally, there's a visit to the doctor and some tests, and those tests might include an ultrasound to date the pregnancy and a variety of blood tests, such things as your blood count, checking your blood group and antibody status, making sure you're immune to certain viruses and negative for other viruses, and checking thyroid, vitamin D, and perhaps some other types of things depending if you bring any individual medical history to the table. Also, there'll be a discussion about options around screening for Down syndrome, and that's something I'll talk about another time. Unfortunately, also one of the things that might happen in the first trimester is the failure of the pregnancy to progress, i.e. miscarriage, and that'll be a topic for another day as well. The second trimester tends to be a time when women feel quite well. You'll get your second wind around 15 to 16 weeks, and usually things like nausea, vomiting, mostly that tends to lift and disappear, and you get your energy back and you actually start to enjoy being pregnant a lot more. One of the things that makes you enjoy it further as that second trimester progresses is feeling the baby move. Usually you'll start to feel the baby move between about 18 and 22 weeks, and that can depend a bit on whether the placenta is at the front or the back of the uterus. That will often determine how early or late you feel fetal movements. It's not a competition. There's always someone you'll meet who says they could feel a baby at 16 weeks. Don't worry if you can't feel it before 20 weeks. It's probably because the placenta is sitting at the front. And then during that time, you'll be sent for an ultrasound at around 20 to 22 weeks to have a look in detail at internal anatomy of the baby, looking for any structural problems, obviously hoping it's going to be all normal. And then towards the end of the second trimester, there'll be a glucose tolerance test to screen for diabetes in pregnancy. Finally, the third trimester. That's a time when you're starting to get quite big. From between 30 and 40 weeks, the baby's really putting on a lot of weight, and you'll start to feel physically more uncomfortable. Sleep might get a little bit more disturbed, needing to turn from side to side, waking up very often to go to the toilet at night to empty the bladder. Fetal movements should continue right through that time. They may reduce a little bit near the end, but any significant reduction in fetal movement should be reported to your doctor or midwife or the hospital you're attending. Visits for checks are typically more frequent. They go to fortnightly, and then towards the end of pregnancy every week. And often discussion then turns to the delivery, concerns you might have over labour, understanding the normal labour process, understanding more about caesarean section if that's the plan you have, and recognising that one can't exactly plan a labour to the nth degree, having an open discussion with your medical carers as to what your hopes are surrounding the birth and what they expect is likely to happen on the day. Thanks very much. I hope this has been helpful, and we'll talk again very soon about another topic. Thank you.